Oh.
So you really
You really do?
No,
Oh.
just on Shannon. Because they felt like they needed
He's
it.
so silly.
I know, yeah, all right, so, if I have a local, small place that I need to move, I can do individual joints or individual motions. I like to stabilize the joint I'm moving and then move the other joint over. But for toes, I'm usually happy with flexion, flexion and extension, just to make sure they're still moving. A lot of people skip toes. If you are working with patients that have neurological problems or even post-knee surgeries and stuff, toes will tighten up and they'll actually start to curl over, and then they won't go into shoes very well. And then if they do go into shoes, they start getting those calluses and things, corns on them because they're rubbing funny. And to me, it's very important to go ahead and get their toes and not just go straight into the ankle.
stabilize the toes?
Well, if I'm doing an individual toe, it shows you in the book the guy's actually grabbing either side of that joint and bending. You know, I can pick which joint I want. You can be closer if you want. You don't have to stay way back from me.
I'm looking at the picture. I was trying to
Yeah. Find a joint. I can feel this joint down here. And move that one. And there's one there. There's one up there. This one cried wee 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 wee.
Well, no, stabilizing it was kind of just because I didn't quite understand what that meant. So
All right.
I kind of wanted to
If I wanted to stretch that joint, you know, doing this, maybe that movement's coming from down here instead of at that joint I wanted. I mean, it moves pretty good there, right? So I could be grabbing this, and it looks like I'm moving this joint, but it's really coming from here. So I'm going to have to grab it just below, proximal to it. You know, if I'm really worrying about it, I'm going to grab this side so that I'm not pushing on the tendons that I'm trying to stretch. Okay. Now, typically when I'm doing toes, I don't individually stretch toes. I'll do the whole thing and up and down. I'm getting all 5 of them. And then if I feel a deficit, I might go back and focus on it a little bit. All right. If I picture my foot in my, I think I might actually have a foot over here. This is a real foot. This isn't just a foot. This is a real foot. Okay, so you see all these little teeny tiny joints? I can hit all those. And then look at my metatarsals here. Those all move too. And my arch is in here. So I like to make sure when what's running from here to here that everybody talks about, the runners and the athletes.
Plantar fascia.
Their plantar fascia. So they get the plantar fasciitis and stuff because they got that big tendon that's running like this, that's holding that arch. So your foot will start to cave down and curl down. So I would like to hold on to these separate joints and move those to maintain that foot position and the foot shape that we want there. So it's easier to see on here than here, but after I do my toes, I'm actually going to grab a met head, the metatarsal head, so I'm grabbing right here, and I'm going to grab the next one, and I'm just going to move them back and forth a little bit. And then I'm going to move to this met head and grab this met head and move them back and forth a little bit. And then I'm going to move down to this one and this one and move them back and forth a little bit to help maintain that range. So I'll grab those guys and just shake them a little bit. And then grab the next ones and shake them a little bit. And grab the next ones and shake them a little bit. This is going to take me a while to go over talking to you guys. If I were doing this for real in the clinic and she was hemiplegic and she'd had a stroke and I needed to stretch this whole side of her body, I would get it done in 10 minutes. Whole thing. Okay, so toes, up and down, shake the met heads. I might even just kind of open that foot up a little bit in general to stretch it. Does it tickle or does it feel good or is it?
It's like getting a foot massage, man.
Okay. All right, so I've done the foot. Now ankle, what motions are at my ankle?
Plantar flexion. Inversion, eversion.
I've heard them all, I think. Okay, so I can invert my ankle. So I can bring it in. I can evert my ankle. I can dorsiflex my ankle. I can plantar flex my ankle, right? So when I hit the ankle, I'm gonna stabilize proximally. So I have a hold of her ankle above it. I'm gonna invert. I'm gonna evert. I'm gonna invert. I'm gonna evert. I'm trying to stay out of the arch of her foot because it's gonna make her, especially if you're ticklish, it's gonna make you want to draw your foot up in a way. And it increases tone and reflexes and stuff. So I personally try pretty hard to stay out. I don't like to grab their foot here, even though in the picture he might be grabbing it there. I don't like that grabbing there. So I try to grab at the pads, the callousy part of that foot to move in and out. So I've inverted and I've everted. Okay. Plantar flexion usually don't have to worry too much about. Very few people are ever going to lose plantar flexion range. Just sitting here, she's in plantar flexion, right? Her feet are already going down. You people on the side of her can see that her foot's already going down. So I can go ahead and push that down. I'm usually not too worried about that one. So the last one's dorsiflexion. There's a couple of ways I can try to do this. Again, I'm going to try to get into the palm or the callousy part of her foot. I can try to bend it up with my hand that way. When I apply pressure on her foot to bend it up, I want all of my pressure, the bulk of my pressure, going through the head of that fifth metatarsal, through baby pig, little pig. Okay, so when I'm pushing here on the bottom of this person's foot, and I'm actually trying to push it diagonally to the inside of their leg. So I'm going to push it up and over. And what that's going to do, it's going to lock this joint in and prevent me from wanting to twist her ankle. And play with this a little bit. I really want you guys to do this a little bit. When you start pushing, try pushing and putting all your pressure at big toe, and you're going to get that. You're going to always get that. You're going to twist their ankle. You're always going to slide off. So I'm going to be pushing from here, and I'm going to be pushing across towards Cassie. And there's a fancy term for that you'll learn in Therex, that position. Okay? So my pressure's there. So I can use my hand. Some people use their whole arm. They'll put their forearm down here, and I'll put it right there on that baby toe, piggy, little piggy, and cup her heel. And now I can just kind of lean into it with my weight and use my 200 pounds to stretch that ankle. I can push pretty hard on that. How much is any big sporty people here? How much pressure can you put on a heel cord? You ever read those things about when people jump and they land and how much pressure that's putting on their body? I mean, we're talking thousands of pounds of pressure that you're putting on that ankle when you jump off a box and land on the ground, and your body's absorbing all that force. They'll say up to 10 times your body weight. So my little pencil arms are not going to rip that ankle in half unless I've got someone that's really super osteoporotic or has some connective tissue disease. I can push pretty stinking hard on that ankle and not worry about hurting that ankle. All right. Thing to think about, and relax your legs as much as you can, is if I'm really pushing hard here, there's going to be pressure at her knee wanting to go backwards there. So I want that knee to not be straight. I want just this teeny tiniest little bit of bend in there. I can do that a lot of ways. I can stick a pillow under there so I don't have to worry about it at all. And then I can bring it up here to almost straight and I can stretch your ankle. I can put one hand under it and hold it and stretch so that I know I'm not going to do it. I've been known to throw my leg up on a table or a bed. Now you got to be careful about things that could be running out of there. And do this number and stretch an ankle. But no matter what position I do it in, I want to think about not hyperextending their knee when I'm pushing on plantar